Welcome to Health System CIO's interview with Ryan Cameron, VP for Technology and Innovation with Children's Nebraska. I'm Anthony Guerra, founder and editor-in-chief. Ryan, thanks for joining me.
Hey, thanks for having me. It's great to get together and talk about some good news around the Thanksgiving holiday.
Yes, sir. Yes, sir. Looking forward to it. All right. So why don't you start off? Tell me a little bit about your organization and your role.
Well, Children's Nebraska, we're the only freestanding children's hospital in our state. We do work with all of our neighboring states, and we're definitely a growing children's hospital with pediatric services. We saw a patient from, at least one patient from every state in the US last year. So sometimes people think about Nebraska as flyover country. We definitely think the opposite of that. We're a very innovation focused organization in one of the most fantastic communities in the Midwest. And yeah, we're really proud of the work that we do in pediatrics.
All right. Very good. And your role. So VP Technology and Innovation. Tell me a little bit about that.
It's a new role for our organization, and I'm relatively new to healthcare. So I haven't quite been in my position for 3 years. Previous to that, I was with an artificial intelligence startup. And then before that, I led technology teams in higher education. And along the way, kind of figured out this notion of formalizing innovation programs and starting think tanks and business accelerators, different programs along those lines. And children's being really focused on this as a part of their strategic plan to enhance patient care. Opened the position up, and I was lucky enough to be invited to give it a go. And it's been a really exciting 3 years. About half of my job is managing the innovation program, our innovation center. That includes digital health, remote patient monitoring, and some of those tethers. And about the other half of my job consists of IT operations and the traditional things that you would think about that a CIO might lead: help desk, project management, data center, all of the things that our infrastructure innovation depends on.
So, do you function as the CIO, or is there also a CIO?
We have a CIIO, which is also pretty unique. So I work for a gentleman. His name's Jerry Buchek. He is an absolute rock star in this business. He's been doing this for about 30 years. So he's been an incredible mentor for me to learn about healthcare and how healthcare works and apply innovation to that. And so I function more or less as a deputy CIO reporting to him.
And he's the Chief Information Innovation Officer?
Correct. That's the
I know
title.
there's one other one in Texas
Oh,
Children's,
awesome.
Myra
Okay.
Davis. Yeah, I believe she's Innovation Information.
Yeah,
So,
I've run into her before.
yeah.
She's an incredible leader.
All right, very cool. So, listen, very timely skills for you. Innovation is all people talking about in healthcare, and you came from an AI startup. So, my goodness, talk about some good qualifications. There are a lot of people who are going to listen to this, and a lot of people in mostly the CIO type roles that really, really want to be innovative, want to be known as innovative, thought of as innovative, want to be sort of move away as much as possible from a keeping the lights on kind of thing, although we know that needs to be done. Um, what are some tips on being innovative? I mean, it's a huge question, and you could spend 2 days on it, but what can you say about that?
The Yeah, that's one of the hardest questions that you could ask. And I think what everybody really struggles with is, how do you prioritize innovation? I think a lot of organizations, they say we want to be innovative, we want to do innovative stuff. It's in our mission statement, it's in our vision statement, which is very true of Children's Nebraska. But how do we get that operational? How do we receive tangible results? How do we bend the needle? How do we really impact patient care and really, provide some positive outcomes for patient families? And the way you do that is you have to measure. If you're going down any pathway with innovation, you got to have good measures. And I'll kind of extrapolate out a little bit further than that. Because it's very easy to say, well, we do process improvement, and that is also innovation. And I would argue that it's not the same. Process improvement is really looking at those iterative gains that, to your point, Anthony, are super important. The 1%, 2%, how do we do this optimally and better? that contributes to a better patient experience, lowering the cost of care, a lot of things that we're deeply concerned with. But at the same time, you have to think about bigger things like consumerism. How can healthcare be better poised and positioned to provide a service that's seamless and accessible and on demand, and the things that we all ultimately are striving for, definitely this year, next year, and moving into, a bright horizon for pediatrics. So you need to tag those projects as innovation projects and say, we don't really know if this is going to work. We're going to take a calculated, controlled, safe risk. And these are things that are going to get us more than an iterative gain. They don't all have to be moonshots. There's also kind of this perception out there that to be innovative, you have to reinvent the wheel. That's not true at all. I think you need to be very design focused and call out an innovation project for what it is, and have really good definitions and tethers around your organization about how you fund that, how you support it, and where you go with it. The thing that we run into quite frequently is a kind of a phenomenon I refer to as heroic innovation, where organizations probably have a cadre of people who strap on that superhero cape, and they have a great idea and they run it from one end to the other. But what happens if they leave? What happens if they get promoted or find a different role? Is it still sustainable? Maybe you won a grant and that funded some really great, research or a process change that's creating a lot of outcomes for you, great outcomes. What happens after that grant, runs out of money? So it's, really quantifying innovation by looking at the measures, separating it from process improvement, and really being focused on sustainability in the long term so that you can get that operationalized and move on to the next challenge.
Lot of stuff in there. Very, very interesting answer. A lot of great information in there. Let's dig down a little bit. One of the things you mentioned was the idea of measuring
Mm,
to see what you've accomplished. So some of the things that one of the issues that's been coming up around some of these AI workflow enhancement tools, ambient listening, things like this, is you hear CIOs talk about the fact that there's a cost involved in these things. These are not free tools. They can be quite expensive. And yet there seems to be a rather soft ROI. We think it's there, although a report just came out the other day that there was not a demonstrable difference. I think it between an organization using an ambient listening tools and the reduction of charting time.
mm.
I'm probably botching that a little bit, but it's going to be in our newsletter this week. We reference the report. People can click through to it. So you have these issues of, you mentioned measurable improvements, measurable outcomes, measuring. We put some effort and energy into something. How much did it improve what we were trying to improve? And then you have, along with that, these issues of expensive tools that we think are going to make our clinicians happier, reduce the cognitive load, reduce burnout, but yet maybe not a hard demonstrable ROI. What are your thoughts around that?
Boy, ambient listening is a great example. And we have a small pilot going on. We utilize a product called DAX. I know a lot of our peers are excited about it. And we've had good results. So I can tell you from a physician standpoint, if you were to talk to Dr. Stephen Dolter, who is our CMIO, very futuristic, very forward thinking, and definitely a reason why we're receiving so many awards and recognition is his work and the work of our team. He would say it's cut down on pajama time. So it's that notion of I've worked a long shift, I'm going home, I'm still doing some epic charting, and I still have to make up that work. And so there are some quantifiable gains in pajama time, process time. I would say that one of the measures that probably is a bit unknown with ambient listening is, are there fewer mistakes and errors by using ambient listening as opposed to 100% a human being? Or, not quite sure which way the scale is going to tip that way. And it is very expensive. This is an area of technology that's ripe for disruption. And I think even open source and some other technologies are going to come out there and start to really make a big impact and difference in that space. That's not a really good one to measure right now. I think a lot of organizations went headstrong into it because AI sounds exciting. And it seems like such an applicable use case to jump in there and see if you can create some value there. I would say the true value of a project like that is it gave an easy opportunity for organizations to dip their toe in the water with generative AI. Because it's scary. The big winners are going to be on more clinical oriented things for decision support. That's where you're going to see, huge gains in terms of outcomes for patients. Maybe cost and operational gains on things that are fully automated as opposed to just kind of partially automated and vetted by a physician like the ambient listening is. So I think it's great that organizations, if they can find the dollars, they get their teams exposed to that technology so that they can train on it and see what the potential is. But I would absolutely, based on our own experience, urge caution in a full-scale adoption of that. And let's wait and see what happens development-wise, because we're seeing a lot of really exciting development with AI. And our thought is the cost of that ought to be going down substantively so that you can adopt it more confidently and not be kind of scrutinizing that dollar amount that can be kind of shocking.
Very good. You mentioned you think the big wins are going to be around real clinical
Yes.
assistance, but that, at least from what I've heard, that is what IT executives and probably operational leaders are deathly afraid of,
Sure.
right? So there's so much trepidation and fear there. That's almost like we're trying to use it everywhere but there. And you think that's where the big win's going to be because people are afraid of getting sued. I mean, let's be honest. What are we afraid of? We're afraid of a bad clinical outcome where the patient can ultimately say, you did this because this stupid algorithm told you to do it and it didn't make any sense and nobody checked it and look what happened to me.
Or even, Anthony, the opposite of that. What if the AI was right and the physician disagreed based on experience and there was a bad outcome and there could be, a litigious situation for that? That door swings both ways in terms of
Mhm.
decision making and how much we trust the algorithm as opposed to, someone who's got a lot of experience and a lot of good skills and training that's required for caregiving. That's 100% where we're going to see those outcomes. So we're going to have to lean in. And I think what's really important for other peer organizations to think about, other CIOs in particular, is how we're going to self-regulate this. Let's be honest and carry that forward. We ought to be very cautious about these technologies because patient safety is always going to be number one. But we know that the cost of care is heavy. We know that the availability of specialists is really challenging. It's hard to recruit people into those roles that could really benefit from AI decision support in a clinical environment. And so we need to lean on the tools just to kind of resolve those two crises. We don't have enough people to offer the care, and the cost of care is too expensive. So if AI can solve those things and produce great patient outcomes, then we're really, all in and excited about it. But we don't have good guidelines and tethers about what's in the black box. So when we evaluate a company at Children's Nebraska, we've done a really interesting thing is we have our own AI policy, we have our own AI governance, we have our own AI affinity group. We talk about it once a month minimum with stakeholders across the whole enterprise. And we're continually thinking about, is this an ethical use of the technology? Is it a moral use? Is it a public or private database? We ask some qualifying questions before we do business with an AI company. And that's given us some opportunities to really kind of think about how to step into it the right way. We're seeing, a really exciting project. Dr. Chris Maloney, who's our physician in chief and very, tech forward. He's using AI with an informatics lens and thinking, if we get real-time analytics, can we use that as a decision support tool? And the case that we have is with epinephrine. So making sure that, the nurse and the physician on call has real-time data coming in about where that level is at, heart rate, flow rate, oxygen, all the things that are relevant to epinephrine, and being able to make quick decisions that are important for the patient to wean them off it earlier. Those are the types of use cases where you're going to see very tangible, very big gains, because it's not terribly expensive to use the infrastructure that you already have. We already have IoT on all our monitoring systems. We just have to interrupt the data stream and apply proven math to that. So I'm not asking generative AI to reinvent the wheel. What I'm doing is I'm taking a proven medical formula to provide care, and I'm automating it with some AI tool sets to get us to those things. So there's some separation too about, is it generative AI? Is it a different type of AI? AI is such a big umbrella term. What I tend to say is we're actually really talking about good machine learning and good automation, not necessarily trying to replicate a physician or a physician making the decision. We're just trying to empower them so that they can make decisions quicker with all of the possible information that they would need right in front of them in an easy way.
All right, very good. What do you think about the idea that you have to be pushing the envelope in this
Mm.
area and you have to be aggressive and you have to be trying things, you have, or you're going to fall behind? Because other people are going to be moving forward. It's almost like you can't sit back. At least that's a feeling I get. The feeling I get is you may not get it right, you may not get it perfect all the time, but if you're not in there, you won't be able to keep up with what it can do.
You know, I it's a very interesting question to ask me that, because again, context. I'm new to healthcare, so I'm gonna give you an answer that I think comes from my own kind of unique lens on that. And my lens is a lot of that urgency isn't necessarily coming from hospitals, that they have to be number one on a particular list, or they're really fighting this, highly competitive battle for patients. We have very unique problems, and the problems that we have, goes back to my earlier point: cost of care, accessibility of care, recruiting people into the profession so that we can solve complicated problems. The complexity and acuity of certain conditions are growing. They're not on the decline. So we have high knowledge, high complexity, high stress, high costs. We have to solve all those things with innovation. So the race is to solve those things because we're worried that healthcare isn't going to be sustainable. And it's very interesting that you see a lot of consumer companies, the big tech companies, trying to move into, I hesitate to use the word profit center, but move into areas of healthcare that are a little bit easier to manage. So urgent care, low-level telehealth things where you're looking at common conditions that, you could resolve in an urgent care setting. A lot of these companies are trying to tackle that, and it's tough for us because healthcare providers are left with the things that we lose money doing, but we need to do. It's the right thing to do to support a community. We have to do those things. And so the chase and the run after innovation is really to kind of solve this problem. Our CEO and president, Chanda Chacon, who is a great innovator and just been a fantastic catalyst to see what Children's has developed and all the great things we've done just in the last 5 years, believes that we need what she describes as a controlled break. So looking at how we offer healthcare today and very carefully and mindfully saying, how do we create a new model that makes sense? That's where the innovation is really happening. I don't think it's, first hospital to use AI for this particular thing. We're trying to solve a very specific problem that's related to accessibility and cost.
Yeah, makes a lot of sense. And we've all experienced that as healthcare consumers. Why are all these urgent care centers popping up? Because it was so difficult to get an appointment with your
Right.
physician. It was unpleasant. Somebody answered the phone, they weren't very nice to you, and they told
Right.
you they might be able to see you in 4 weeks or 3 weeks. And now you have an organization down the street that's open 18 hours a day, and you can make an appointment online and you can get an appointment that day. I mean, the experience has been night and day, but health systems had to wake up to that and say,
Right.
we need to change. Somebody was eating our lunch, so to speak.
Well, it's a tough battle too. I mean, we've seen some of those big companies try and fail.
Hmm.
We've seen that happen a couple of times. I won't name names, but it doesn't take a lot of research to see some of these big box companies that said, "Hey, we're going to do healthcare, give it a shot," and then roll back that plan very quickly because they realize that it is very expensive and very complex. It's difficult to recruit care providers, but to their point, they understand how to deliver a service in a seamless and quick way that is relevant for the current generation.
Hmm.
Somewhere around 22% of the population in the United States requires pediatric care today. And if you look at, the parents of those children, they're used to receiving services just as you described. On demand, I pull up an app, I self-schedule my appointment, someone greets me right away, I can text questions back and forth. And so that innovation scramble is really focused on that consumer mindset so that we can deliver that service really well. I think historically, most healthcare organizations have been focused on designing systems that were easy for them to manage themselves, but not necessarily patient-centered. And so you hear that term pop up a lot, patient-centered care. And as a new CIO to the healthcare environment, that's a great lesson for me to learn, is that it means more than convenience too. It's really convenient for an AI algorithm to take a look at a bunch of CT scans and say, hey, Ryan, you might have cancer, and it could send me a text.
Hmm.
But I'll tell you what, I don't want to hear that from a text message.
From a chatbot.
Yeah, that's a really big critical moment in my life. And, I need the human factor too. And so what an organization like Children's Nebraska is striving to do is have a really good balance of what we learned on how to deliver compassionate care that really makes an impact. And so if you were to get that, shocking or scary diagnosis, the message that I want to hear back is, this is where you're at, but we're going to be a team. We're here for you. We're going to do everything we can to support you along the way. And a bot can't deliver that. It can deliver it very cleanly, very quickly, very cheaply, but it's not necessarily the best care. So there's a balance in there that we're striving to achieve. And so what we're trying to learn from consumer models is how to be convenient and accessible. But at the same time, we're going to bring our own values and our own structure to that so that we can provide very human-centered care.
Just had a thought as you were talking about, compassionate care, having a compassionate approach. We usually focus on the clinical aspect when we talk about patient care and compassion, but receiving care, you can be compassionate in a lot of other ways as an organization.
Sure.
You can help people find their parking. You can help them with wayfinding, find where they're trying to get. You can help them around billing. I mean, people can have billing problems, and that may be mostly with the insurance companies, where there's no compassion there at all. You can have compassion around scheduling appointments and rescheduling appointments,
Yep.
especially with children. So there's a lot of ways to be compassionate, and there's a lot of points where technology can help that patient experience. Make sense?
Yeah, you're spot on. The way I describe it quite frequently is most of healthcare's problems stem from scale without empathy. Um, you know, and I mean maybe that's true of society too. If you look at, we're going into Black Friday and all the consumer oriented things that are super exciting as an American, but at the same time we understand that those have consequences and effects too in terms of the environment, sustainability, managing your budget, all of those other things that come part and parcel with that. So if you have tremendous scale without empathy, you're going to fail. If you're going to be innovative in healthcare, it's got to be empathy led, empathy focused, and then think about the scale and how you deliver that. So I really liked how you described that. I think you nailed it.
Do you have an example that comes to mind? You talk about scaling without empathy. Give me an example of how that
Yeah.
could look.
So with one project that I could point to really quickly is, and we're super excited about this one. We've partnered with Steelcase, Logitech, and a company called Ocular, who have an emerging technology, and they call it a volumetric hologram. And so I always use the word hologram. People get super excited, like it's Walt Disney or a theme ride or something like that. That's not what we're building, but it's a phone booth, and it's for telehealth. And so rather than getting the kind of the Brady Bunch boxes that you get in a Zoom meeting, maybe the audio is good, maybe the audio is bad, you've got maybe a tiny head or a big head, depending on
Hmm.
how someone set up their camera, it doesn't feel comfortable. And right now there are patients, particularly in Nebraska, that has a lot of folks that are farming communities, ag communities. Everybody is not necessarily in the metro. They'll either have to drive 3 or 4 hours to go meet with a behavioral health provider, or they'll do a Zoom meeting or a Teams meeting or something like that. And so we feel like we can do better, and we
Mm,
call it believe in better. And so we saw this technology about 2 years ago at CES. We called the companies and we said, "Hey, would you be willing to trial this for telehealth and telemedicine for behavioral health appointments?" And they said, "That's super exciting." And so at each point, there's basically a phone booth. I'll use the word phone booth. It's a video suite, has a sophisticated camera array. It has soft lighting, really great sound in there. And you get an identical sized person at each end of
mm,
the conversation. And it's so much better of a comfort level in a meaningful environment. We've already started to see patients in it. We're receiving positive feedback about how it makes an impact when you're having those tough conversations. If you're talking about something, for example, let's say managing anxiety or a
mhm.
lot of the behavioral health things that our kids face these days, it's so much better to have that environment than just kind of a Zoom call or imagine, if you will, someone's in their car and they're FaceTiming with you. That's not a great venue for it.
Mhm.
So we're doing a hub and spoke model, and we have a pilot going where we have one in Kearney, Nebraska, which is about 3 hours away from the Omaha Metro, and we have another unit here at our innovation center, the Mammal Innovation Center at Children's Nebraska, and we think that that's scale with empathy, because the
Mm,
design starts with thinking about what is the ideal patient and patient family experience for these types of appointments.
mhm.
But we recognize the scale problem, which is if I live in Valentine and I need to drive a full day to come to a metro or come to an area where I can get that care, that's not going to work. But if I can deploy these units out to our clinics, then we can do that very quickly and rapidly and still have a quality, empathetic experience.
So the more you put these out at different clinics, the more you create those circles of accessibility where someone might have to drive a half hour as opposed to driving 4 hours.
Oh, exactly right.
Yeah.
Yeah, exactly right. And it's great for clinicians too, because they feel like that they can be very focused. There's not all these buttons and things on the screens that are distracting them from really watching and understanding and listening to the patient. So it really creates a modality of care that we think is very, very different and super exciting. And yeah, you could argue that the complexity is you still need point to point. You still have to have,
Mm.
this at one facility and this at the other facility. But we feel like that's a fair investment to make. It's the right tools for the job. And if you start from that ideal experience and what people are feeling,
Mhm.
you really get some compelling innovations there. It would be scary for me to have that conversation over, just a standard, web conferencing app.
And I think what you're providing I'm guessing would be choice,
Yeah,
meaning if I'm more comfortable in my house because I don't want
sure.
to be seen, I don't want to go, I want to be in my quiet, happy space with my phone and I'll FaceTime. Somebody may say I prefer that. Somebody may say I prefer this more immersive experience. So people would get choice.
Yeah, choice is important. We also do run into, particularly if you're out of state, some licensure things as well.
Hmm.
So there is a driving factor and a rationale for having a patient at a clinic, because that opens the door to the type of care that we can legally provide based on how kind of that telehealth, telemedicine regulatory environment works as
Yeah.
well. But choice is definitely important for consumers. It's got some novelty to it too. And if you think about kids and having an incentive for them to go to the doctor, make it more of a pleasant experience than kind of a scary experience, we think that that's a benefit too.
Yeah. Well, I would try it out. Sounds interesting.
Oh yeah,
All right. Well, one of the reasons we got on the phone today, and we're actually almost out of time, so I want to touch on this is you won this tremendous award. It's a combination of an award from KLAS and CHIME. The Synergy Award um, has to do with doing well on the Pinnacle Award winner for KLAS, and then level 9 or above on the CHIME Most Wired Digital Health. So this is not something everybody wins. This is a pretty special award. So. Um, Maybe we touched on some of the things that you may have wanted for, but if you want to articulate any of the other initiatives or projects that you think contributed to that, that'd be great.
well, first and foremost, we're honored by it. It's incredible to be recognized. I said earlier, some people think of Nebraska as flyover country, and to see people paying attention to what we're doing and recognizing it is a really big deal for us. It really puts fire in our bellies, and we work, even harder than we do when we get that recognition. And congratulations to Memorial Healthcare System in Hollywood, Florida, who also won this award. It was inaugural, so this is the first year that this award has been offered. And so it was really cool to be a part of that. How did we get there? We got there really by being focused on both satisfaction and IT infrastructure. And that's really what this award is all about, because Most Wired challenges organizations to really think about, are they leaning into innovation? Do they have the appropriate infrastructure to be able to support IT initiatives and really grow and be nimble? And so CHIME's developed a fantastic tool. That's exactly how we use it. We benchmark against it. We set goals every year. And we're always striving for number 10. And congrats to the number 10 winners. We were number 9 winner, so we just squeaked in there. And then on KLAS, having satisfaction with our EHR, wow. People, routinely don't like being in an EHR. So, shout out to Dr. Stephen Dolter, Toy West, Stacy Zuha, all the incredible people on the team who stay connected with our clinicians, stay connected with our providers and our nurses, and really listen very carefully. And, we've gone so far as to use tracking technology with glasses that look at people's eyes. So we can look at clinical pathways and, total user experience and doing design around that. And ultimately, the goal is to reduce time that's required to be in that EHR system, to be nimble and quick and accurate and safe, so that they can spend more time with our patients. So we got there by being intentional. Benchmark those things, make them a part of your strategic plan, make them a part of your, performance goals. And you'll definitely be, on your way to receiving your own Synergy Award. And we just have the best team that there is. We're all just so focused on care, and it's, pediatrics is super rewarding. So we're just very blessed to have the team that we have.
Let me ask you about infrastructure. You're an innovation guy. Sometimes innovation guys don't think much about infrastructure, but
Sure.
I have a feeling you are quite sensitive to it. What are your thoughts around sort of a stakes to play? You got to have that IT infrastructure if you want to do any of this fun stuff.
It's critical. It not only do you have to have good infrastructure, you have to have a leapfrog and iterative mindset in terms of investment. It's years ago, it was, hey, let's talk about everybody's going to be cloud first. And then cloud first moved into hyperconvergence, and then hyperconvergence moved into digital twins. And there's always going to be something that's an advancement from the infrastructure standpoint. But what's important is not kind of nickel and diming your way to that, to all of a sudden get to a point where like, oh, we don't have the bandwidth or the capacity to go further. You mentioned AI earlier. A lot of people are using, one of the cloud provided services to have, AI systems or tools. They need big databases that are protected and ultra secure. You need all of those things so that you can execute on where you need to go. So you have to have a really healthy refresh cycle. You have to be thinking about not just annual purchases, but maybe 3-year and 5-year purchases to continually keep up with that. It's tough. It's a tough gambit to be in. The thing that I worry about right now with AI is energy and power. Do we have the power infrastructure to support all these fantastic developments that are happening with AI? I don't know if we do. And so, infrastructure means more than just the hospital. It means the city, it means the state, it means the country in terms of having that grid and that infrastructure to power all of that so that we can continue to be successful.
Right. It's not quite mining Bitcoin, but
No,
it gets up there, right? I mean,
no,
those
we
are, here's
definitely
some
have
funny
moved.
stuff around that, right?
Yeah, it's a really interesting space to watch. We'll see. I think every administration has their own lens on it. Every country has their own unique lens on it too. Bitcoin and e-commerce, I don't really get into that too much. But what I do follow very closely for healthcare would be the blockchain. And I would argue that blockchain technology will also require distributed server infrastructure, lots of power, lots of security. And for example, if we could move EHRs onto the blockchain, we could save billions in terms of security and infrastructure in the United States alone. So I think, blockchain is something that will probably impact us a lot more, close to home than, maybe accepting Bitcoin for care services.
So blockchain still has a chance to do something in healthcare, because
I think
about
so.
4 years ago, everyone was talking about it. I haven't heard a word about it in a while. You think
Yeah.
it's still going to have an impact?
I do. I very much do. I haven't really stopped watching it. Where you're seeing it be very successful is in European countries and nations where they're using it to manage real estate transactions. And it kind of comes from a sad place of necessity. There have been some instances where there's been civil unrest and somebody had a property deed or had purchased a piece of property, but it was no longer validated by that government. The records were lost or burned or destroyed, and so there's really no way for that
Uh-huh.
person to come back and say, I owned this house, I owned this business. And so the blockchain, I think you'll start to see, the UN, you'll start to see a lot of countries get together and start looking at it very closely as a means to manage and regulate that in a very ethical and safe way. It's highly secure. It's got a lot of possibility for EHR systems and for medical data. So I remain very optimistic and excited about it.
What? Why didn't it take hold? Or why hasn't it yet? Why does there seem to be a delay?
People don't understand it. It's kind of difficult to look at. It
Mm-hmm.
actually took me a long time to learn about it.
Mm,
There was a couple of years ago, Omaha it's a city I absolutely love. It's a city of innovators. There was a blockchain conference in Omaha, Nebraska, and this is going back like 5-6 years.
mm-hmm.
And we had a lot of different speakers from around the world come in and talk to all the Fortune 500s that are in town, a lot of the universities and organizations, kind of explore it. And it took me some study to understand how that decentralized system is ultimately secure and how it works. And so if you dig into the science of it and you understand it better, people get a little more excited about it. They'll probably rebrand it and call it something else. And I think you'll start to see really when governments start looking at the cost of care and where those cost centers are. Blockchain is a quick and easy solution for a lot of the things that are happening with security right now. It's crazy how much money we have to spend on security.
I'm going to let you go. Let me just make the point that yes, rebranding can work, because we know that what used to be a water bottle became a
Sure.
hydro flask
Oh,
and
there you go.
quadrupled in price. And I'm like, what is a hydro flask? It's a water bottle.
Yeah.
Anyway,
How
good
about
stuff. Ryan, an absolute pleasure to chat with you today, and I hope we get to catch up again soon. Thank you.
Yeah, thanks for having me and for the opportunity to share our story.
You got it. Have a great day.
Take care.